Hello class. I am here with Miss Brittany, registered nurse of 8 years, and she's going to help us through our review today. Brittany, say hello.
Hi everybody.
So on last week, we talked a little bit more about paternal and eternal routes, the routes of administration, and what falls under those categories in particular. So we talked about oral, rectal, things of that nature that will fall under our eternal, and then paternal. It's going to be more of our IVs, our sublinguals, our non-ejectable routes, and things of that nature. Okay, so if we reflect back to what we talked about, we want to make sure you remember the 6 rights of administration under any circumstance, regardless of whatever drug is being administered. You want to make sure you have the right patient, the right drug, the right route, the right time, the right documentation. Did I mention everything?
The right dosage.
And the right dosage. So the dosage plays a part. Remember, we talked about a while back, say if our patient is overweight, you want to make sure they have amount of dosage according to their ideal body weight. Or if it's a child, if it's a pediatric dosage. So that plays a part of how the drug is actually going to operate in the body based on our dosage. So those 6 things are very important to remember. One thing I showed you guys in the video is every time a physician enters the room before they even administer the medicine, the one thing they do is they lift the arm to check the band to make sure they have the right patient. Then they want to go to the system, check what the system says, check everything against the doctor's orders, and make sure everything is ready before you start to administer. So we have a couple of special circumstances that we want to talk about as far as allergies or NPO. So you always want to monitor the patient's vitals. How important is that, Miss Brittany?
It's very important that you monitor their vitals while you're giving any type of medications, especially medications that you need to check blood pressures and the respirations and the rate, because some heart medicines, a lot of heart medicines that you give, that's always going to be the main concern, is to make sure that you get that blood pressure and that heart rate before you give anything, because you don't want anybody to drop too low.
And also when we're talking about our it's not coming out.
It's okay.
When we talk about our anti-hypertension, you always want to be sure you check the blood pressure with that and record what it is. So make sure you're educated about the drug. Why is that particular patient getting that drug? What is wrong? What's going on? What are the possible side effects? Does this person have allergies? Will any of their other conditions or previous diseases or anything of that nature cause any sort of drug interaction with what they have going on? And should we worry about getting another kind of form of drug? Should we consult a physician who might have overlooked it? So all those things play a factor, and it kind of goes under special conditions. So now let's talk a little bit more about special conditions for oral administration. So we talked about dosage calculations. Just to go back really briefly, we talked about the dosage calculations. So in the event that the doctor's order is different from what you have on hand, you want to go back to actually do the calculations yourself and check with somebody for accuracy. So you want to make sure it's either an instructor or somebody in a clinical setting who has the proper knowledge on this thing. A lot of times you're going to have a system in place where you can actually go in and put it in but sometimes you want to verify the system. You can never be too right. So we're going to talk about the special conditions or considerations for oral administration. So I always give the most important medicines first. For example, if we have a cardiac medicine, we want to make sure we give that before a vitamin. So that's the most important. We need to get the drug doing what it needs to do for the main source, for the main treatment. Right. And then go ahead and follow up with whatever else is necessary. Order of operations. Okay? Make sure the patient's head is elevated. So if we're doing an oral, you want to make sure the patient's head is actually elevated for easier swallowing. So you don't want them to choke. You want to make sure you raise the bed if need be. If they're standing up, make sure it's easier for that pill to actually penetrate. We talked about the different drug forms at one point in time. We talked about the capsules and then the tablets, how one is actually coated and one of them is not. So here is an actual capsule. The body of that capsule is designed for easier swallowing versus the tablet. The tablet, on the other hand, might be a little tougher to swallow. So you want to make sure that patient is able to get that pill down by elevating their head. Also, always administer the pills with water. Okay? Just avoid taking any kind of fruit juices or milk, because any kind of acid or alkaline products will kind of interrupt the action or the interaction of the drug. So make sure you always kind of administer with water unless indicated otherwise, okay? Also, that's very important with our antibiotics as well. Now, do not administer any medication that if it looks discolored, if it looks like it might be outdated. You don't want to cause any issues that you don't have to. So you want to check the dates, make sure it's not expired, anything of that nature. So just make sure you pay close attention. Sometimes in a hospital setting, we could be moving too fast, whether it's even in a doctor's office setting. We're just grabbing and we're giving. And then later on, we might have a consequence. Did you have anything to add on that?
Yeah, just make sure that first of all, you're able to read the label. Make sure that it's not so old, or it's not so chipped away, or water hasn't eroded the label to where you can't see visibly what the label says. Even if you know the drug and you've given it several times, you still always want to make sure that it's visible to read.
Okay, awesome. And actually, they kind of get into that a little bit more as we move later on in the liquid medications. So when you're actually pouring your liquid medications in your bottle, so you're just gonna make sure your label is faced up, so that actual liquid won't smear and mess up the label on that bottle. So like we mentioned, as well, some special considerations. Remember, if a patient is NPO, that means nothing by mouth, or refuses the medication or vomits within 20 or 30 minutes of taking the actual medication, you want to make sure you report that and put it in the chart. You want to document the record with the time of when they might have actually vomit. You want to actually see if you could look and see whether the pill was all together, whether it actually broke up a little bit, was it intact. Just kind of document all those things. Also, if they refuse to take a medication, you want to always document that, always, and then you want to determine the reason why.
And if they refuse a medication and you're somewhere in a facility working or in a clinic setting, you want to make sure that you tell the person in charge that they refuse that medication, because it might be something important like insulin or high blood pressure medicine or cardiac medicine. You want to make sure that you tell the nurse or whoever it is that is your supervisor, instead of just documenting alone.
Okay, awesome. And also, like we said, some tablets can be crushed and some cannot. So you want to make sure you actually consult with someone on which ones can be and which cannot. You never want to crush it with your hand or anything like this. You actually want to use a pill crusher, where you're going to insert the pill here and grind it up. Now you can, under certain circumstances, use applesauce, ice cream, or pudding. So you want to make sure you're actually consulting your physician on what it is that you have to take, or whether you can't swallow. Is that medicine okay to be grinded and inserted in something else? Because some medicines have timers and you actually mess that up. So make sure you consult with them first before you decide to do that on your own. Okay? So now, like I say, if a patient is unable to swallow a tablet or capsule whole, the package insert should be reviewed by a pharmacist. So like I said, we want to make sure if it's something that can be disrupted, that we don't disrupt the original dosage form. Okay, and then we talked about preparations of liquid medications. So if it is something that's the liquid, you want to actually shake the bottle. If it tells you to shake the bottle. Like we said, keep the label upside to prevent the smearing of the label, because you want to always be able to go back to it and know what it says and use it properly, but you need to be able to identify what it is. Place the medicine cup at eye level when you're actually pouring it. When administering liquid medication to someone who cannot drink from a cup, such as an infant or a person with wired jaws, a syringe may be used. Okay? Have you had to do that before, Miss Brittany?
Yeah. You can use a syringe, like she said. Just place Place it to the side. Also, infants, you do that a lot. If you're going to work in a clinic setting with pediatric patients or with elderly patients, you're going to be putting a lot of the liquid medications to the side of their mouths because it's easier for them to swallow and it's just more comfortable.
And like she said, in addition to that, place the syringe tip in the pocket between the cheeks and the gums. And then you want to, when administer a large amount of liquid via syringe, it helps to fit at least a 2-inch length of latex tubing on the syringe tip to facilitate. So that'll kind of help a lot with it. Like she said, you want to place it inside the gum. So, inside the mouth between the cheek and the gum. Okay. Also, administration of medication by the
nasogastric tube.
Would you like to touch on that?
Okay, so basically, what an NG tube is just a long tube that's inserted through the nose and it goes past the mouth and past the esophagus and it goes down to we'll just say it just goes down to the stomach. And it just is another way or another form. It's invasive. It's another form of nutrition. If a person can't or hasn't been eating or if they're in a comatose state, usually this is a temporary fix for people who can't chew or eat or they're having problems or their jaw is wired shut and they just lost their appetite and they're just unable to eat anymore. This is a quick fix. This is what they'll do first before they'll insert a tube in your stomach.
Okay, which is considered our gastric tube. So our gastric tube is, like she said, similar, and the process is actually much similar as the one she just mentioned. The only difference is you're going to omit the tube as being properly placed in the stomach and verify that the tape is an appropriate marking because that'll already be done for you. So when we're actually administering a medicine with the gastric tube, normally you're going to make sure the patient's really still. Okay, and the medicine's going to be grinded up in water and it's going to be placed into the tube first. And then normally they have like a formula that they'll go back maybe 2 or 3 or 2.5, just depends on how much they have to have. And then after that, you want to actually flush the tube with water. So they're going to actually tell you, you want to make sure you're giving at least maybe 2 to 3 times with water after that.
And then most of the times you'll have, if you're the one that has to do something like this, or if you just need to know that this person has an NG tube, the doctor will have certain orders. Like he might say, I want 200 mLs of water flushed after this feeding. So you'll never just have to decide how much a person gets on their own. You can always go back to the doctor's notes, whatever he prescribed, he or she.
Now, in the event that you're actually administering medicine through the gastric tube and the patient looks discomfort or is coughing or laughing, whatever it causes that medicine or the formula to rise back up, you want to actually pinch that tube to stop the flow. Okay? And then we have administering of medication rectally. This is our suppositories and our enemas. So we have 2 different forms, and these are normally your most common forms. You want to make sure you always, under any circumstances, make sure you do well with the confidentiality. Make sure our curtains are closed. Make sure our doors are closed. You want to respect that patient and give them the utmost privacy, especially during that procedure. So, like I said, we have our suppositories, and then we have our enemas. And these would be the most, and the enema is just given, it's similar to like the retention enema, is similar to just like the one that you use for a detox. So it does the same thing, but you want to make sure, you keep it in for a while to make sure it does what it needs to do, as well as the position that you have the patient in to make sure it penetrates properly. Brittany?
Okay, so basically, with a rectal enema and a suppository, you usually wouldn't be the ones giving it, but you will be the ones assisting the person who is giving it. And It's always to the side, a lateral left position. You always take the patient to the side and then hold their left leg up, and you'll be the one assisting whoever's giving the medication. You want to make sure that you're able to, after an enema or a suppository, you want to make sure that you hold the cheeks close and tight, and keep that area warm, and you don't want it to ooze back out. You don't want the medication to drop on the bed or wherever you are, and you don't and there may be a lot of defecation going on, so you want to make sure that you're always there and they're comfortable, and most of all that they're safe and they don't feel like threatened or in an awkward position. You're just there to make them feel comfortable while you're assisting giving this medication.
And then with the enema, it's normally going to be lubricated with something, so you want to make sure it's always lubricated for the most comfort. And you want to lubricate your finger that you're using to insert the enema.
On a glove.
On a glove, not your bare hand. That would be nasty. So, also in addition to that, sometimes you're going to have a patient that might be uncooperative or unconscious, to where you might have to actually tape together their buttocks. So you want to do that with 2-inch paper adhesive for about 30 minutes. And then, like I said, don't only do it if it's necessary. If that person is uncooperative or unconscious, don't just restrain them to restrain them.
Well, lawfully, you can't just restrain a person. The only time I've ever seen this done is where a doctor has ordered that to happen, because a patient either refused to cooperate or a patient couldn't cooperate, such as a pediatric patient, a 6-month-old baby can't hold their cheeks tight together. So those are things in place just to keep to help the absorption of the medicine. But you wouldn't be determining if a person should have tape adhesed to their buttocks for 30 minutes. That would be a special order. You would never have to decide that on your own.
I always remember that. Stay out of trouble. Okay, and then we also talked about our sublinguals. So our sublinguals are what we place underneath the tongue. So it looks just a little like this little tube here. Just going to squeeze it and get some of that inside and place it underneath your tongue. It's going to hit your blood vessel and distribute that way. You also have what's called a buccal
administration.
So buccal is going to be placed within your jaw. It's just going to sit there to absorb. It's almost like those Listerine strips we used to eat and just let it dissolve. So it does something similar, but you want to put it right there in your cheek. Buccals are not as rapid as I would say as a sublingual. So more than likely you're going to always get the sublingual first. And this drug is absorbed, like I said, right into the circulation through the numerous blood vessels, and that's right underneath your tongue. So if you have medications absorbed by 2 different routes, and if it's unaffected by the stomach, the intestines, or the liver. So absorption via the route is rapid and used frequently. A quick response is required. So if you're needing somebody like to, let's say, help me out, I'm lost for words. So if you need something like whatever the patient's going through, and you need the medicine to work quick, you don't really have time to say, okay, well, the buccal might be good, but the sublingual is the quicker turnaround.
Well, usually like buccal medicines aren't as prescribed as much as sublinguals are. You can buy sublingual vitamins. I take a vitamin B12 that's sublingual now. They use nitroglycerin. That's a medicine for a patient with chronic heart disease and heart conditions. They take that when they're having chest pains. You can take baby aspirin. There are some baby aspirin that are prescribed that are sublingual, so they'll act fast in a moment of emergency. That's the whole point of a medication being sublingual, because they need it to act rapidly and fast. It's something that doesn't have to go through the GI process. It goes straight through the blood vessels.
Awesome. And then we talked about some transdermals. So those systems deliver the medication by the absorption of the skin. So it just kind of depends. Sometimes it will be more of your patches. Sometimes if you use a topical such as this, and actually put it inside the patch, and then you will place it on the skin for it to actually absorb. So this is a topical. Remember, a topical is something that's actually placed on your skin, just to go ahead and work that way. It can either be like a vapor rub or something like that. That's a topical. So make sure you remember that. But the actual transdermal is when we place the cream inside the patch to absorb. So that's going to go ahead and do what it needs to do. It's going to be embedded inside of that. And then we talked about some inhalation. Inhalation routes. Would you like to touch on that?
Yeah, most inhalation drugs that you'll see, they'll mostly be for people with COPD or asthma, people with lung diseases, anything that involves the lungs or the respiratory system or even the heart. You'll see a lot of people on different like rescue inhalers, albuterol treatments, nebulizers are one of them. They're just aerosol medications that dissolve into the air through gases. That's all there are. They're just medicine in gases that will go straight into the lungs. They don't have to go through the GI system. They don't have to go through blood vessels. They go directly through the lungs. That's all they really are.
And some of the advantages, as mentioned, is a rapid effect of a drug. It's a rapid, so it can be a small amount, and it still minimizes side effects, and it still produces a therapeutic effect. Now, some of the disadvantages of using it is when you have, say, somebody that's having an asthma attack, and they're under panic, and you need them to calm down and use the proper breathing techniques to actually administer the medicine properly. But if they're not calming down, or they're just kind of in shock, then it kind of works against what it is that we're trying to do with the medicine. Okay. So like I said, one thing that we'll talk about a little bit more is called IPPB, and it combines administration of an acerol with a medical breather to assist patients who are unable to take deep breaths on their own. So it's not commonly used, but it may be ordered by a physician. Okay. And then we have different routes of injections. So we have syringes, we have needles, we have a lot of different things that fit within those categories. Here is actually a insulin pen. So this would be similar. You have a little small needle on that. So like anything that has to kind of penetrate your skin, whether it's intramuscular, IV, anything of that nature. Intrathermal injections are usually administered to the skin only on the inner surface of the lower arm.
So that would just be like a TB test. Most nurses would do it. It's just it goes directly under the skin, and it's only 15 degrees, 0 to 15 degrees under the skin, and that's what an intradermal would be.
Okay. So this was a small review, you guys. We have several other ways that you can administer medicine. But we want to make sure you know a little bit more in depth about what routes actually fit under eternal and paternal. You know, we still have our nose drops. We still have our eye drops. Anything of that nature can still fit within those categories. So we actually have some medicines that can be chewed. So this is a pill, a nausea pill, and it's a tablet that can be chewed. So, you know, from time to time, you will have different situations. And there, like I said, there are so many things out. Times are changing. So the more creative we get, the different approaches we can take. So some differences might apply. But you want to make sure you actually read your textbooks, review back to the other videos, and be ready for class. Thank you, Miss Brittany, so much for joining me.
My pleasure. Good luck.